we want to talk to you today about recovery because everyone asks us how long until I see results. Do you hear this like all day? Hi everyone, and welcome to Lipstick and Lipo, your unfiltered guide to plastic surgery by two board-certified plastic surgeons. I am one of those two. I'm Dr. Ashley Amalfi. I'm a board-certified plastic surgeon in Rochester, New York, and I'm joined by my dear friend, who's also a board-certified plastic surgeon, Dr. Smita in New Jersey. Hi, girlie.
Hi guys. Hi Ash. It's so nice to see you this week. I'm so excited about our series.
Lipo series. So
yes,
this is great. I mean, there's so many questions to answer about liposuction. You know, one of the most common procedures year over year in the United States for plastic surgery. And so we want to talk to you today about recovery because everyone asks us how long until I see results. Do you hear this like all day?
All day. And it's an important question.
Yeah, you want to know.
Ask, right? You want to know, especially if you're planning things, you want things to be done, so you're bikini ready and all of that. So it's important to ask, and we certainly get asked a lot. And if you don't ask, we will talk about it because we want you to be the best prepared for your recovery process so there's no surprises.
Yeah. I mean, the first thing is that right away, it looks amazing. And so I think that that's like exciting for people, right? Like on day one, when they take those garments off and they took a look at everything, it's like, holy cow, this looks amazing. Yeah. On day one, this is exactly what I signed up for, right? It's like that early excitement.
Right, exactly. I mean, I think that sort of it's like the same excitement that we get in the operating room, right? When you're doing like, when you're like performing the procedure and you're sucking out all the fat and, you know, oftentimes there are endpoints of when to stop or, you know, we sort of pinch the skin and make sure everything is uniform. And so when we sort of get that, we're like, oh, this is so great. She's going to have the best results or he's going to have the best results. And then you sort of see that when you first take off your bandages. I always take pictures too.
I was going to say, I take a lot of pictures too, because then it's helpful to show them like, oh my gosh, this is why I'm so excited. You're going to be excited because this is what it's going to look like. So
and
it's so funny. Yeah, and then it gets worse.
So all of that excitement just deteriorates.
Yeah, and then
that's normal.
They get swollen. I mean, they kind of puff up like a marshmallow. And I always tell people, like, it's gonna get worse before it gets better. It looks awesome, and then I always see people, like, almost get, like, depressed about it. Like, oh my God, it almost looks worse than it did before. Why did I do that? And that is just the normal swelling process. Because it's really a beat up, you know, it really beats up the tissue and it gets really inflamed and swollen in response to that. And the timeline for that, I always feel like is like 3 to 4 weeks where things kind of get really puffy, really hard, really bruised. And then I see people get a little bit frustrated in that period.
Yeah, I mean, I think it sometimes can even start earlier, like even at that 2-week mark, right? Especially if it's like the arms or legs where those areas are just a little bit tougher to start with. I mean, you know, and you're like wrapping your arms and your compression, like all of this stuff. But I think starting at 2 weeks, definitely at 3 and 4 weeks, you're just like, why? Like, why did I do this? It's hard. It's lumpy. It's like
but
stiff.
That's it, right? That's how long it lasts. It's just a couple of those weeks. You know, you are like immediately it looks awesome. Then as the weeks go on, it starts to get pretty swollen and not so cool. And then it turns the corner, right? And then I always feel like at that month mark, we really start to see things change and everything just starts to shrink down in the best way possible.
Yeah, well, exactly. And I think that's why, and we'll talk about this, I think, on another episode, but that's why compression is also so great because it does help minimize some of that swelling. And so I always say, like, listen, you know, we're taking out the fat, but your body is going to fill that up with fluid, which is essentially swelling. And so the quicker we can resolve that swelling, the quicker that skin, you know, can shrink because now it's got the space to do so. It doesn't have that, like, limiting factor. So, but once, like you said, after that 1 month and then every week after that just gets better and better. And, you know, I don't know, we talked about this before, but oftentimes on the arms, legs, and then even, especially when I'm doing larger area liposuction, I always have them get lymphatic massages.
Yeah,
Just
it
because
helps.
I think it definitely helps with the swelling and it helps that skin stay mobile, right? Because you don't want it to
Yes.
scar down and get stuck.
Yeah.
That's really important. That's a really
Mhm.
important thing because I think some people, it's like sore and so they're afraid to touch it. And if
Yeah.
you don't touch that skin, then when all that swelling goes away, it's going to create some scar tissue that's going to shrink it down and it might be wrinkly and weird and not lay down in a really nice, smooth way. So you want to be like massaging those layers and rolling it around.
Exactly. But yeah, I mean, but once that like 6 week, 3 months, I mean, then you're really starting to see your results at 6 months. Like, I mean, just every month is just better and better. And then, then you're like, okay, like this is why I did this. Like, this is amazing. Like, what else can I do? So, but it is a process. I mean, I don't know, Ashley, have you ever seen those, I saw it a lot on social media, those graphs that talk about the healing process, and it's not just like a straight line up, but it's more these like peaks and valleys. And this is sort of the perfect example, right? Like everything is great in the beginning and then you get this dip and then it starts to go up. But you're going to have these little episodes where it might not be that great, but ultimately you're still on that upward trajectory to like great results.
Absolutely. And then you'll get there and it's always worth it. But, I think the key here is patience. Patience is key when it comes to liposuction. We'll give you a glimpse of where you're heading, but just trust us. And in a couple of months, you're going to get there.
Yep. You always do. And you always are excited and happy. So this is a great episode for anyone who is in the process of getting liposuction, to really just understand what to expect so that you are prepared to sort of do your best and heal your best and not get too discouraged.
All right. Take care, you guys.
Bye, guys. See you next week.